And the next speaker is Lukan Mishev from Bulgaria with presentation about 3D visualization, digital filtering, and intraoperative fluorescein angioscopy in vitreoretinal surgery. Hello.
Hello, do you hear me?
Yeah, we hear you.
Perfect. Just a moment. Okay, thank you for the invitation to present here. I will talk about the 3D visualization, digital filtering, and intraoperative fluorescein angioscopy in vitreoretinal surgery. These are my disclosures, and some of them are particularly related to the topic. I will mainly cover two systems with which I have experience. This is the Alcon Ingenuity, and the most important thing here is that we have manual depth control and exposure control, which heavily influences the image quality that surgeon perceives. The other important thing is that we have two HDR sensors, meaning high dynamic range, which are paired with the high dynamic range screen, which is also important. This is the other system, C-Luma from Bausch & Lomb, the new completely digital platform. This is me in my operating room making the first human surgeries with the microscope, and it is equipped with two 4K sensors, and also it depicts in 1082 by 1080p on the 3D screen. Why we are talking about dynamic range and what is dynamic range basically? The dynamic range is the ability of a single pixel from the sensor matrix to create meaningful image data in the lowest light conditions and in the highest light conditions. So you can think about it as a window of acquisition and ability of the sensor to see more image data. The human eye has 100 decibels dynamic range, and in the cinematographic world, the dynamic range is measured in stop. Why I do this comparison? In order to compare it with mid-range DSLR or high-end cinema cameras, which have basically between 40 to 78 decibels. The Ingenuity camera has 85 decibels, meaning it's closer to the human eye, which is a good thing. These are the available 3D surgical system at the moment, and you can see that only the Alcon disclosed the dynamic range of the camera, and OcuTRX are claiming basically similar dynamic range. All the others, Sizestar Tivo, C-Luma from BNL, Bionics One, they don't disclose their dynamic range, but they claim higher resolution. And there is a catch here. We need to know that higher resolution on similar size sensors means smaller pixels, and the pixel size determines the dynamic range. So we need to think about it and always look to the image that we get. And what I mean by that is here on the left side, you see dynamic range clipping. These are the white spots which you might see over the surface of the eye. And on the right side image, you see a different system with a lower dynamic range, meaning that the area of the clipped image, the white spot, is larger. So this depicts the explanation of the dynamic range. There is another thing also important called instrumental presbyopia, meaning that when we are looking through the oculars, our accommodation multiplies or enhances the accommodation of or the depth of focus of the analog microscope. And with the digital systems, we are independent from our accommodation, meaning that we are independent from the presbyopia, and this is far vision, and we have a consistent depth of focus of the microscope, which is important especially for surgeons in presbyopic age, like me. So here I will just show the ability to enhance the depth of focus playing with the slider of the Ingenuity, and you can see the fundus vessels without any contact lens or any wide field viewing system attached to the microscope. So it's impressive. Also, in the past, there was some concerns about latency, and you can see how I play with the capsule here, and I wouldn't allow myself if there was a latency. Otherwise, I would create a PCR. So the issue with the latency, especially with the Ingenuity, doesn't exist anymore, at least in my opinion. So next thing I want to show is ILM enhancement filter. On the left side, you see the enhanced image. On the right side, you see the regular one. This imaging modality and comparison is achieved by mounting two Ingenuity systems on same microscope in order to be able to create a real-time comparison between both. Here you can see how the filtered image behaves under air. We know that we have a lot of reflections, we lose borders under air. So I think that the filtered image somehow enhances my ability to see the borders and to see and work more precisely during fluid air exchange maneuvers and drainage of the PFCL as in this case. And also you can see better the vascular structures, and in my opinion it helps me to do my job better. Next image, which is quite new, is actually intraoperative fluorescein angioscopy. It is angioscopy because it is a continuous imaging, and you can appreciate here in this diabetic case the capillary dropout, the lack of perfusion in choroid in some areas, and good perfusion in other areas, which might determine our behavior later, meaning PRP and specific areas which we need to treat with laser also. For the first time, there is a visualization system in ophthalmology which can be used as intraoperative diagnostic tool or navigational device. So we are getting closer to the neurosurgeons which are using such approaches for a long time ago. So you can see that the image resolution and the overall quality of the image is not bad at all. You can of course use different types of digital filters. What is important in my approach is that I don't use a hardware barrier filter mounted on the microscope. I use the Ingenuity and I created a digital filtering sequence which is able to capture the fluorescence of the intravenous or intra-arterial fluorescein solution. Of course, to achieve that, you need to have a dedicated light source with the proper excitation light bandwidth, which in my case is 490 nanometers wavelength, and you can appreciate the macular structures, meaning that you might see the CME. So this is a brief case in which we saw something like an embolus in one of the vessels, two embolus, and we were wondering if this is an occlusion or there is a perfusion. And the intraoperative fluorescein angio showed us that there is no interruption in the blood flow, meaning that these are arteriosclerotic plaques but not embolus. So again, it's a decision-making tool. In this case, we spotted a lack of choroidal filling and early hyperfluorescence of the optic nerve. And we thought that during our surgery, there is somehow an impending ischemic incident on the optic nerve. And what we decided to do was to apply intravenous RTPA plus fraxiparin. And in the end of the surgery, we saw diminishment of the choroidal lack of filling, and probably we got lucky or we saved the eye, but on the next day the eye was with vision. So here it's another example of angioscopy where I can identify that this is a blood collection and not a bleeding vessel. Otherwise, if it was a vessel, the blood would be fluorescent. So I don't need to apply any diathermy here. And vice versa, this is a leaking point which I will diathermize and I will prevent further bleeding from this area. So again, this is an intraoperative navigational tool or diagnostic device. Next, another interesting approach, it's a fluoroscopic vitrectomy. Since 1979, Machemer introduced the vitrectomy, and since that time, we are just guessing where is the vitreous, or we are anticipating it by some collateral things like flow rate or something like that. On the right side image, you can see the regular view with fluorescein in the eye, but on the left side, you can see the fluoroscopic visualization where you can see everything actually, and you might be amazed how much vitreous we often leave in the periphery simply because we don't see it. And we just assume that we cleaned everything, but with fluoroscopic visualization, we might see what we are removing and we can use high flow rate. As you see, I'm using 620 because I don't expect or anticipate retina jumping. I see what I'm cutting at the moment. So the fluoroscopic vitrectomy, I do believe that will somehow change our way of cleaning the vitreous, but it's a matter of time. Next case which I want to show is vitreoretinal adhesion over a lattice area. We all know from the anatomy that there is an intimate connection between the vitreous and the lattice areas, but here you can see it quite clearly and you can remove it really precise without inducing any additional breaks by pulling or somehow touching the retina, simply because you see what you're removing. It's not a transparent tissue anymore because the fluorescein is highly attracted to the vitreous. This is another example of the fluoroscopic visualization where you can see actually the well-known Schlieren phenomena or the subretinal fluid drainage. And you can see it quite well with the fluoroscopic visualization. Here it is. And also you might be certain that you drained almost everything because you see what you drain. What happens when you start to play more with the endoillumination? This is an example of the constellation endoillumination model modification with special filters, which can achieve different wavelengths of illumination and how they can help us during vitrectomy or something else. Here, for example, I'm using 550 nanometers light and different filters over that light. And of course, playing with the digital image gives us the opportunity to enhance certain details from the overall composite image. So you saw the choroidal vessels here, and it's a matter of somehow imagination what you can do actually with the digital filtering. This is another example on a highly complicated diabetic case. I'm using 550 nanometer light to highlight the vitreous. You can see it quite well, and you can see and remove the vitreous more effectively, in my opinion, because in vitreoretinal surgery, if we see, we are allowed to work, and we work better if we don't see what we are supposed to remove from the eye. Now, this is a 490 nanometer excitation with the intraoperative fluorescein angio showing the advanced ischemia in that retina, and At the beginning, you might think that this case is actually hopeless in terms of perfusion, and unfortunately, we often have such type of patients. Uh, so what we're gonna do here, and let's see, this is the regular image of this retina, already stained with membrane blue duo, and this is the normal imaging more or less, and this is autofluorescent filter which prove to enhance the membranes, and also you can see the vessels and are they are perfused or not. So we need to modify our way of looking into the ocular structures, because the analog view sometimes contains a lot more info inside, but it's not highlighted. With the digital filtering, we can suppress certain wavelengths and we can enhance others which might be useful for us during that part of the procedure. So in that case, you can see other type of filter. This is actually the ION filter, and this is the fluoroscopic, not fluoroscopic, autofluorescence of the anterior segment, and also autofluorescence of the posterior segment, and me cutting one of these uh, membranes. This is other type of illumination, which is 532. Uh, so no, it's 579 actually, because it's a bit yellow, but it can show how, playing with the multi-wavelength and illumination, we might extract more information from the surgical field at this type of the, or this part of the procedure. You can see the membrane here, which I try to gently remove because sometimes we might induce or enlarge existing macular holes. But anyways, if we see better, I do believe that we do the surgery better. And this is something else which is related to the anterior segment, but I think it's equally important. This is fundus enhancement reflex, in which you can see on the right side of the image how it increases the transparency of the pieces and the transparency of the cortex, also the contrast between the tissues. So this is something else that is quite helpful in anterior segment surgery. Sometimes it's helpful in doing cataract in hemophthalmos eyes, because it enhances the fundus reflections, albeit they are somehow impaired by the existing blood there. This is a contrast enhancement filter for irrigation and aspiration, and you can see the comparison here between the both sides of the image. And lastly, here there is a visionary edit which shows area of interest filtering, because up to now I am filtering the older image, and albeit I enhance the area of interest, I lose a lot of details in the peripheral tissues. As you see here in the limbus and in the conjunctiva, the vessels are not like in the normal image. So the future will be applying areas of interest and filtering only that area, and the rest of the eye should look normal. I call this image fusion, and this is the next thing that probably Alcon or some of the other manufacturers should think of doing, because it will enhance our performance significantly. So you can see the differences here. Here it is. And last but not least, something important in our environment today, remote training and observation in real-time 4K. It can be done with certain types of encoders and decoders, and VR glasses like Goovis Pro, Avegant Glyph, and you can connect your Ingenuity directly to such encoder, and on the other side of the world, where another colleague has a decoder and connection with internet, can see exactly or similar image as you in the operating room. The only thing will be the internet latency as a difference. And of course, nowadays there are meetings organized in metaverse, and we share videos in 3D there. So this might be a new way of communication between the colleagues or a new conference type of platform. And that's it. Thank you for the invitation to present here.
Thank you very much for fantastic presentation, fantastic information, Dr. Lukan. So we have a ingenuity system, but can board it not so fast. So I think we have a few questions from the audience.
Sure.
Maybe please colleague. So I have one question. So I start to use Ingenuity maybe 1 month, and I have some problems.
Yes.
First of them, I saw that you use chandelier illuminating system, yes, for your surgery. I use 3-port vitrectomy typically, and I have some aberration when my light falling to the metal or vitreal probe or forceps or something else. I see something light around. Yes,
yeah, reflections.
It's not very good. Can you say about your experience? Do you try to change it, or do you know the way how I can change this problem and solve it?
Yeah, this is related to the dynamic range of the system, as I showed on the previous slide. There is a certain level above which the sensor produces only white light, meaning that when you are close to your instruments, you reach the upper limit of the dynamic range. So you just need to pull up and keep the probe of your light more vertical, and to rely more on a reflected light than a direct light. Also, when you are playing with your slider, I would suggest starting in 30%. And if you don't have enough light in the posterior segment, you might increase it to no more than 50. And also it is related to the microscope which you are using, and for example the biome. If you are using biome, there is a lens, the gold one, which will increase the depth of focus of the overall system. So for the light, keep it more vertical and not directly to shiny surfaces. And for the depth of focus, play with the slider, because it changes the depth of focus and the light amount, the exposure.
Thank you very much. Maybe another questions from audience?
Yeah, just
Professor Henrich from Lugano University.
Yeah.
Please.
I'm not sure, is the microphone on?
Yes, I hear well, actually.
Oh, okay, fantastic. This is Bernard Henrich from Switzerland, yes. Thanks a lot for the presentation. Just one technical question, it might have escaped my attention, but I'm curious how these digital filters are produced. I imagine that an LED light source is used in the system with like red, green, blue light sources, and then probably what I imagine is that the filter consists in a mix of those 3 light sources, correct?
No. It's a composition between 2 components. The first one is the endo illumination. In my case, I use a xenon light source. And in the xenon light source, in the constellation, there are filter trays. They exist. In this filter trays, you can put certain optical filters just to filter the wavelength that you need. And that is the way you achieve the excitation light. And then to catch the image, you need to create your custom color profile in the Ingenuity software. And this is the second component.
Okay, I see. So it's actually not just a virtual filter. It is a true filter then.
True, in the endo illumination is a true filter. But
exactly.
The barrier filter, which needs to catch the fluorescence, for example, it's a digital filter. It's not a barrier filter, optical one, which you should normally put on the microscope to resemble a fundus camera.
Fantastic, thanks.
Yeah.
Thank you, Professor Donano. Another question from the panel, from Yakov Gritsenko, please.
Thank you very much for your interesting report. I have one question about cataract surgery. In your case, you show us using ingenuity system in this in the surgeons of posterior segment of the eye. I have a question. Do you ever performed posterior capsulorhexis using ingenuity and your filters? And do you have enough focus depth for this procedure? Because I tried once to use ingenuity system for cataract surgery, and for performing posterior capsulorhexis, it was very difficult to do it because I don't have enough focusing. Thank you.
Yes, I have done posterior rhexis, and basically in that times I don't use any oculars at all, even for a complex anterior segment reconstructions. As I said in my presentation, it's absolutely important how you play with the slider which controls the depth of focus on the camera. And if you are too open, meaning that you are above 50%, you will get more light and shallow depth of field. Also, it depends from the microscope which you are using, because the stereo base of the Zeiss, Leica and Mueller-Wedel are different. You will have more depth of focus with the Ingenuity in Zeiss Alcon platform, which are the same, and less in Mueller-Wedel. I don't know what is your microscope, but you can play with the slider, and if you don't have depth of focus, you just need to close the slider, because in 30% open slider, only the Ingenuity system adds 21 millimeters of depth of focus, which is huge, and I think it's enough for anterior segment. So it's a matter of adjustment, probably.
Thank you very much.
You're welcome.
Thank you, Lukan. Fantastic presentation.